The groin reconstruction that we do has a very high success rate. 97% of people will get back to doing the sports they enjoy. Now, it's important to make sure that obviously you're doing the right operation on the right people. Now, most of the time it can be fairly obvious when you take a history and examine somebody that that's what they've got. Some people will need other scans and investigations, and usually we would use MRI scans and ultrasound scans. And particularly what we're looking for now is a condition called femoroacetabular impingement syndrome, which is a condition of the hip where the hip joint doesn't move properly in the socket of the hip, and it knocks against the socket of the hip and it can restrict the movement of the hip joint. Now, the difficulty is that hip pain will often present in the groin, so it can be hard to tell. An MRI scan is very good at picking this up, but again, often we'll find people have hip problems and groin problems, and they have both, in which case we usually fix the groin first, because actually that's the more straightforward operation. Having a hip operated on, if you're in your early 20s, is very major surgery. And if we fix the groin and we find that allows their muscles to function better again, it may be that the acetabular impingement can be left and it may never cause any trouble. But it is vitally important that we do these other scans to make sure there aren't any other pathologies going on as well.